So why talking about weight isn't fat shaming someone? It's actually enabling them. It should be a conversation that leaves the client feeling empowered to make change and take action. Weight has a huge stigma associated with it, which can bring a host of other secondary implications like psychological health, eating behaviours, changes in physical activity behaviours, access to healthcare services. And I hear a lot of comments from clients like, I know I need to lose weight, it's not that important, I'll get to it. Or, I know I've put on a bit of weight, but I can't seem to shift it, I'm sure it'll be okay, won't it? And yes, whilst it's not life limiting, it will massively impact on the lifespan of your joints. If we think about this from a clinical perspective, from our joint health perspective, there are lots of other topics that we could be talking about that this is completely relevant to, but as I'm a physio nutritionist, let's start with joint health. To put this into perspective, for every kilo of weight lost, the knee joint peak forces reduced by 2.2 kilos and the hip around 2.5 kilos. So to keep the maths simple, if you lost 10 kilos, that's around 25 kilograms less going through your hip and around 22 less going through your knee. That's huge. Now imagine that across a month, a year, 5 years. That's a massive difference. In addition, excess body weight, so adipose tissue, high BMI, high fat tissue, does increase inflammatory adipokines and cytokines. And these are essentially pro-inflammatory molecules which are harmful to the workings of the joint. So why am I bringing this up? To increase awareness? Maybe. To catch the ear of someone who this resonates with? Yeah, perhaps. As a healthcare professional, I have the duty to educate and tackle this with people, to stand with you and to help. It's about having open and honest conversations, honest discussions. If you've asked me to work with you and with your long-standing joint pain and your weight is higher than ideal, it is a topic that we're going to talk about. And that's not to make anyone embarrassed. It's designed to empower you, to enable you to take control, to feel supported with actioning what needs to be done. I see so many healthcare professionals who hand out leaflets with a smile and just expect people to make change with no other education, with no other help. And lo and behold, it doesn't happen. And this is particularly important in a modern world where our average body weight is increasing and where the quick fix is so easy to get hold of now. And it's often not a quick fix because the underlying behaviours haven't been spoken about and they haven't been dealt with. And B, where, okay, definitely for the better, we've all stopped trying to be as skinny as we want to be because we thought that was good once upon a time. But I do fear that we're going in the other direction a little bit, and you can be curvy and happy and healthy, absolutely, that's not what I'm saying. But you can also be overweight and unhealthy, and that's the truth. So if you're a client listening to this and this sounds like familiar to you and you need some help, reach out. You know, I'm happy to discuss things. Let's see if we can work together. Let's see if I can help. If you're a healthcare professional and this also sounds like the sort of things that you do better. You know that you can do better for your clients.